A big shout out and thank you to our featured sponsors. Special thanks to Jane Haas Photography for sharing your elegant space with the Nurtured Woman podcast. Elevate your online presence effortlessly with Jane Haas's personal brand photography. Don't settle for less. Book your transformational session today. Call 732-673-9893. Get your home summer ready with Bleaches NC. Is your carpet looking tired or stubborn stains and odors lingering? Let Bleaches NC IICRC certified specialists use advanced technology to give your carpets and upholstery a fresh, sanitized look. Safe for your family and pets, they'll make your home feel like new. Mention the Nurtured Woman podcast for 15% off your first cleaning. Call 984-51-GRIME or 984-514-7463 today. Looking to buy or sell your home in the Lake Norman area? Trust me, reach out to Kristen Dorninger. With years of local experience, Kristen makes the real estate process smooth and stress-free. Get personalized guidance whether you're buying your dream home or wanting to sell it for the best price. Call her today at 704-492-6573. Welcome to The Nurtured Woman, a podcast bringing you conversations from a wide range of guests, from medical and wellness practitioners to wine and culinary experts, fashion leaders, and other trusted field insiders. Join me, Michele Droll, your guide, as we delve into topics that inspire you. In this episode, Dr. Katrina Heath, a leading expert in pelvic health rehabilitation, explains how pelvic floor therapy goes far beyond traditional physical therapy. She shares how these often overlooked muscles affect everything from posture and core strength to fertility, incontinence, and chronic pain. With a focus on lasting full-body solutions rather than quick fixes, Dr. Heath offers insight into how pelvic floor therapy can benefit people of all ages and stages of life, men, women, and children alike. Whether you're dealing with discomfort now or looking to prevent issues down the road, this conversation sheds light on a vital part of your health that deserves more attention. Good morning, Katrina. Thank you for joining us.
Good morning, Michelle. I'm so excited to be here today.
So I understand that you are a doctor of physical therapy. Is that correct?
Yeah.
What does that mean?
That means that I am able to be a physical therapist. After becoming a physical therapist, I got my bachelor's, then I got a master's, and then the program continued on to get my doctorate in physical therapy.
Okay. And you are a physical therapist of pelvic floor health.
Yes. So I am a physical therapist in general, meaning we can help rehabilitate any muscle in the body from head to toe. So I went to regular physical therapy school. And then after that, I took up a specialty in pelvic floor therapy. And so I did get a certification to be a pelvic health rehabilitation therapist.
What is pelvic floor? Explain that a little bit. I don't think that I have a really good handle on it.
Yeah.
And why is it important?
And why is it important? Okay, I love this question. So first of all, your pelvic floor is a group of muscles that every person has. So whether you're a woman, whether you're a male, whether you're a child, you have a pelvic floor. Those muscles help to support your organs. So it's going to support your uterus. It's going to support your bladder. It's going to support your rectum. It's going to support all the organs of the abdominal wall. And it's important that that muscle knows how to breathe. It knows how to move. It knows how to expand. It can open. It can close. It is used because we need that support. If you don't have it, then the organs will then tend to have too much pressure, come down, and then we call it a prolapse. It needs to be able to open and close so that you can go to the bathroom when you want to, right? You don't want to always hold everything in, and you don't want to always let everything out.
Very important.
Yes, and they have to be able to close and open.
Okay. Thanks for that explanation. Can you go further, though, and talk to me about what pelvic floor health actually means?
So just as you would take care of the health of your body in general, whether it's your nutrition, whether it's your muscles, you have things, specific things that you would do for that, right? So your pelvic health, again, these are a bowl of muscles that lie in the bottom of your pelvis. So it sits between your pubic bone and your tailbone. You want them to be able to support the organs in your abdominal wall. And so taking care of those muscles may mean, one, am I getting enough water to drink so that I'm not going to the bathroom all night? Two, if I see that I have increased frequency, what does that mean? Is this normal? Should I be going to the bathroom more than 8 times within a 24-hour period? If you are doing that, then guess what? We need to touch up on the health of your pelvic floor, because that is not something that is normal. If you're going too little, for example, you only use the bathroom twice a day. And I think about my teachers who have what we call teacher bladder or nurse's bladder. They hold it all day long. You only go to the bathroom twice a day. Is that normal? No. But we do that when we're younger. So that's not really taking care of our pelvic.
Does that cause problems holding that bladder?
Absolutely. When people get older, it'll usually lead to other things. For example, urinary retention. So you want to go to the bathroom now, but you can't go. Your body just is in that holding pattern. And so when you want to open those muscles, it won't happen. And so you'll have urinary retention. Sometimes people have urinary frequency when they get older. Sometimes they'll move into pain. Your body just establishes a pattern. And so we like to say, take care of your pelvic health now, so that when you get older, you don't have those problems.
Understood. So besides bladder issues, incontinence, retention, what other issues might women be affected by?
For pelvic floor health. So typically, constipation is a huge problem. And most of the time, people don't think of the pelvic floor for dealing with things like constipation. But it is huge when it comes to pelvic health. And it's partly because your rectum sits right in the base of your pelvic floor. So you have your bladder, you have your uterus here at the top, and then at the back wall is the rectum. Well, guess what happens? If that rectum gets full, it's going to then begin to put pressure onto the bladder, making you have the urinary frequency, the urinary leakage sometimes, or urinary tract infections, which a lot of people deal with, recurrent urinary tract infections. And so typically you have to get that rectum, clear it out, and allow the muscles in the pelvic wall to be able to breathe a little bit and have room to be able to move the way it needs to cut down on the step.
Okay. I've heard many women discuss pelvic organ prolapse. Can you share more about what that is?
Yes. So prolapse can be from different areas, right? Your uterus can prolapse, meaning your uterus moves through the vaginal wall. Your bladder can prolapse. So the bladder could come down through the vaginal wall, as well as your rectum can prolapse. So your rectum can actually come through the vaginal wall if it's not supported. And then your intestines can also come down as well. So there are different types of prolapse. The more prominent one that we treat is bladder prolapse and uterine prolapse, and rectal prolapse too, but the more common ones are the bladder and the uterus. Why? Because we all have not all, but a lot of people have babies. And so they push them out vaginally. And if those muscles, again, don't come back and are not supported, and then it can push through. But it doesn't have to just be uterus. Sometimes it's the bladder. Sometimes it's all three.
So I was surprised when you and I had spoke a few days ago, you had said that men and children are also affected. Tell me about them. What are some main issues that they would be impacted by?
So with kids, constipation, encopresis, bedwetting. Those are a lot of things that the kids come to me for. And I will say, along with that, sometimes even incontinence, which we call giggle incontinence. Giggle incontinence is where a kid laughs and then they pee on themselves a little bit. And so that happens. And sometimes that can happen as a result of trauma that a child may have had. It may happen as a result of them having other urinary issues when they were born. They may have had surgeries or anything like that. And so typically those are some of the different diagnoses that we treat for children. For men, they can have problems with pain in their pelvic floor. So specifically like right around the anus, they may have something called proctalgia fugax, which is huge when it comes to spasms right around their external sphincter. It feels like a sharp pain is going through their anus. Men after prostate cancer. So they may have what we call a prostatectomy, where the prostate is removed. But sometimes when that happens, there's a severing of nerves that happens. And the doctors don't always talk to males about, you may have incontinence afterwards because some of those muscles or nerves may be tampered with and you may not necessarily be able to control it. And so prostatectomies, prostatitis, which is huge with men, it's an inflamed prostate. But anytime there's pain in the area, a lot of times people tend to categorize it as prostatitis. And it's not always prostatitis, because true prostatitis can be fixed with antibiotics. But what happens with a lot of the doctors, urologists, sometimes they'll put a male on antibiotics multiple times in a row. And then that leads to a whole syndrome of increased pain. The nerves are inflamed. They have a lot of tightness in the area, and they really just can't sit anymore. And it causes erectile dysfunction and then all the other things that inflammation can produce within the pelvic wall. So that's how it affects women and men and children.
Okay, thanks for that. So, Katrina, what should someone expect when they come to see you for the first time? They realize that they have these problems. Maybe their primary physician has referred them to see you. What do you do when they come to visit?
Yeah, so we're doing a full body assessment. We're looking from head to toe, looking at their range of motion, looking at their strength. We're looking at their ability to be able to stand up, sit down. How do their pelvis move? How do their hips move? What are their knees doing? So whatever's happening in the spine is going to happen at the hip, is going to happen at the ankle. So we're looking at the full body. And then on day one, depending on the patient and what their diagnosis is, we will offer to do a vaginal exam or rectal exam. We don't always do that on the first day. It depends on the client, and it depends on if they're really anxious about it. Maybe they've had a lot of traumatic experiences in the past, or they've been to pelvic physical therapy before. It didn't work, and so they're a little hesitant, and I will work with that for sure. We will work on their breathing. We may have to sit and figure out where their headspace is, and may have to do a little mindset retraining so that they think of their bodies in different ways and don't just feel like, oh, I'm never going to get better. It's never going to happen. We may have to do a little bit of training with that to reset their mind. But then after that, again, we're moving into more of the breathing, because believe it or not, your pelvic floor is connected to your diaphragm. They move together. When you inhale, your diaphragm and your pelvic floor should be descending. When you exhale, it should be elevating. There should be a constant movement. But when people don't know how to breathe properly, those muscles don't work synergistically the way that they should. They don't move as well. And so sometimes just focusing on the breathing will get people better. Okay. Sometimes just focusing on breathing will get people out of pain.
So it sounds like a more gentle start to pelvic floor therapy.
Yes, depending on what the patient wants. Some people are very like, get in there. I'm ready for the vaginal exam, whenever you need to do to get me better. And then there are others who are a little bit more hesitant, and I'm okay with either one.
Well, then let's talk about that. What types of treatments or techniques would you use in therapy for somebody who's fully ready to move right in?
So I call my hands healers, because we do a lot of manual therapy, lots and lots of manual therapy, which means my hands are on you, guiding you, helping you with your breathing. I do fascial release. So we call it myofascial release. I'm doing that externally. Sometimes I'll have to do an internal exam with one digit where I go into the pelvic wall, whether that's vaginally or rectally, depending on what the patient needs. And I'm assessing for muscle tension, tightness, restrictions, fascial restrictions. I'm looking to see, do you have good movement of the pelvic floor? So sometimes if you don't, and there are specific spaces that are tense, I'll just leave one digit there. And just have you breathe while I hold that. And a lot of times it will just dissipate. That tense muscle now becomes relaxed. And then I give them a home program, and I tell them to go home, practice this with yourself, practice this with your partner or whatever. Sometimes I'll even have couples come into a session together where they're able to help one another.
Coming right back. Don't go away. Expert cleaning you can trust. Is your carpet looking tired? Stains that won't budge? Smell not so pleasant? We've got you covered. At Bleaches and our IICRC certified specialists use state-of-the-art cleaning technology to remove dirt, stains, smells, and allergens from your carpets and upholstery, leaving them fresh, sanitized, and looking their very best. We take pride in long-lasting results with a meticulous approach that's safe for your family and pets. Exclusive offer, mention the Nurtured Woman podcast and save 15% on your first cleaning. Call 984-51-GRIME or 984-514-7463 to book your appointment today. That's Bleaches NC. Did you know that homes listed with the real estate agent sell faster and for more money than those sold by the owner? It's true. And when it comes to selling, no one works harder for you than Kristen Dorninger, a trusted real estate agent with Southern Homes of the Carolinas. She knows the Lake Norman market inside and out, and she's got the marketing, the strategy, and the negotiation skills to get your home sold for top dollar. If you're thinking of selling, don't just list it, Sell it smarter with Kristen. Call Kristen Dorninger today at 704-928-6573. Welcome back to The Nurtured Woman. Now let's dive back into our conversation. Talk to me about how pelvic floor therapy can help things like endometriosis or reoccurring UTIs, the prolapse. How does it assist with that?
So pelvic floor health therapy is going to be helpful in all of those senses. So you said endometriosis.
Yes.
Endometriosis has a lot to do with pelvic pain, right? And so a lot of tension around the abdominal wall, around the uterine wall. For people who don't know what endometriosis is, it's an inflamed tissue, right, that grows. It's endometrial tissue that's growing on the outside of the uterus, and it can also attach itself to the rectum, to the bladder, to different places, and it causes a lot of pain. And so what we do as pelvic therapists, again, is we do that assessment externally. We're trying to get the breathing pattern to change. We're trying to get the pelvic floor to move a little bit better. Internally, we go back and do the assessment. Where are you having the tension? Where do you have the trigger points? What needs to be released and what needs to be removed? So when I say removed, do we need to change anything about your walking pattern, sitting pattern, postural awareness? Do we need to change any of those things? Again, it helps with endometriosis and pelvic pain in general.
Okay. Now, why UTIs? Why does it treat UTIs?
Because again, remember I was telling you, a lot of people who have urinary tract infections have some issues going on with their rectum. So they may have constipation issues. If they do, we need to help them clear that out with their diet. Sometimes the muscles are really tense in the anus and they are unable to relax those muscles. So what happens? They push, right? The rectum pushes against the bladder and the bladder is not able to empty completely. Again, the bladder may not be able to empty because you're not drinking as much. Or you may be drinking acidic drinks, sodas and coffees and teas and things that kind of irritate the bladder a little bit. And again, you're holding that urine inside of the bladder and it's not emptying completely. So that stale urine that's in there can breed bacteria and then cause reoccurring urinary tract infections.
Okay.
Also, you have to think about, how are women wiping? Are they wiping from back to front? Are they wiping from front to back? So just teaching people how to make sure they're taking care of their health in that way, especially kids who have recurring urinary tract infections. A lot of times it's the way they're wiping. And again, the bacteria is getting inside of the urethra, causing more inflammation to happen and bacteria to grow.
It's often recommended that women perform Kegel exercises. Can you tell me more about them? How do they help?
Okay. So Kegel exercises are tightening of the vaginal wall. So you're tightening really more so from back to front. So think about if you were pulling in the anus, pulling in the vagina, pulling all the way up to your bladder, right? And so you're pulling from back to front. It's a lifting, it's a tightening, right? But think about it. Everybody doesn't need to be tighter in that area. Some people need to learn to relax. Majority of people need to learn to relax a little bit. And so what I have found is not giving patients Kegels has actually been more helpful than giving them Kegels. And so one of the things that a lot of doctors will say is make sure you're doing your Kegels, especially after having births and you want to tighten things up in that area. And yes, you may need to do that, but you also need to learn how to relax before you move into tightening. If you don't know how to relax, then that muscle has nowhere to go. If the muscle is already tight, right? And so you're trying to get the muscle to move, it doesn't have anywhere to go. But if you learn how to relax the muscle first, then when you tighten, you have somewhere to go.
Understood. If someone presents to you with pain, what are some things you can actually do to treat?
So one of the first things that I'm going to do to treat is I'm going to do breathing exercises with them. And the reason why we want to do the breathing exercises is because it activates what we call your vagus nerve. Vagus nerve comes all the way from your esophagus, so here at the top, and it goes all the way down through your gut, down into the pelvic floor. And so what we're trying to do with this is learn how to move a little bit better throughout this area. And what helps us the most is our
Through the
diaphragm.
esophagus. We're trying to learn how to move better.
Exactly. So your vagus nerve really needs to be activated through breath work. So we use the abdominal wall, we use our diaphragm in order to ignite that. And so if you are doing deep breaths, your diaphragm is moving. And not only is your diaphragm moving, your pelvic floor, again, is moving. And so with the diaphragm being activated through deep breathing or different types of breathing, I actually teach a class on breathing because it affects pain so much. The neuroscience behind it is that if you can really get that diaphragm moving and activate your vagus nerve, it's going to help calm those symptoms, not just pain, but also digestion.
Katrina, I was really surprised the other day when you and I spoke. We talked about how pelvic floor therapy can assist couples who are trying to conceive. Can you share any stories with us of a patient that might have come in and been treated for that?
Yes, absolutely. So I recall a patient coming to me because they had had recurrent urinary tract infections. They had been constipated. They had had endometriosis, all the things, right? And so they came in and they said, I want to be able to conceive. I've been trying for a couple of years, but I've not been able to do that. And I said, you know what? I don't make any promises, but let's get you breathing better. Let's get your posture to be a little bit better. Let's get you to learn to relax. Let's get your constipation taken care of. Let's do some fascial releases around your abdominal wall. And then we did some internal work, doing some releases around their uterus and their cervix and different areas that they were restricted. And I taught them a few myofascial techniques to do for themselves at home. And guess what? I saw her for 6 visits. And then a month later, she called and he said, I'm pregnant.
Oh, that's wonderful.
What?
Nice story.
It really did not take very long at all. To be honest, within the time frame, it was probably about 12 weeks. I'll even push it out and say 16, but that's huge after you've been trying for years.
Sure it is.
So,
and I'm sure you have other stories, patients suffering from other issues as well.
Yes, even pelvic pain. I remember a lady coming to me who was unable to have intercourse with her husband for 9 years. 9 years. She'd been married. She had children at this point, 2 kids. But still unable to have intercourse at all. And we did all of the things, again, looking at your breathing pattern, looking at your pelvic floor tension. We had to use dilators at that time. And it took her 9 visits to see me. And she's like, my husband's sending you flowers because now I am able to have intercourse. And again, she had children already, but she had to go through IVF. And she said, if someone had just told me about pelvic floor therapy 9 years ago.
Oh, wow.
I wouldn't be in the same position, but here we are. So, yeah.
Wow. What about pelvic floor therapy for people who are pelvic floor healthy? Is there a reason to follow these techniques?
Yes. So I would say that there is a reason to follow these techniques. Even if you feel that your pelvic floor is healthy and you don't have problems with leakage, you don't have problems with pain, you don't have problems with prolapse, again, preventive care is always acceptable, right? We don't want to have reactive health. We want to have proactive health. And so for me, I want to know, even if I don't have these problems right now, what can I do to prevent myself from these problems? So 1, am I able to move my pelvic floor when I want to? Am I able to do a Kegel when I want to? Am I able to relax my pelvic floor when I need to? Do I know what it feels like to breathe and be able to feel my pelvic floor muscles relax and open? Am I having the type of response to intimacy that I want to, right? And so if I want a stronger response, maybe I need to do something a little bit different now to be able to take care of my pelvic health. So I always feel like breathing exercises help, yoga helps, hypopressive exercises help, just being able to be in a space where you're able to feel the muscles moving, right? If you have issues going on with your pelvis at all, even if you don't have incontinence right now, if you know I have low back pain, if you know I have problems with hip range of motion or hip strength, you probably have an issue forming with the pelvic floor. And the reason is because your hip muscles are attached to the pelvic floor. Matter of fact, the third layer of your pelvic floor muscles is the hip obturator internus. Yeah.
Okay.
And that muscle helps you externally rotate. And if a lot of times if you have problems with external rotation, that leads to pelvic floor.
Katrina, so informative. How would someone find you?
So my company is J Heath Therapy. That's the letter J. Heath is my last name, Heath Therapy. And I have a mobile business right now. So I come to you. Wherever your location is, I will come to you. I also share an office in South Charlotte with a dermatologist, and I'm able to see patients in that office as well. My phone number is 704-412-2001, or you can feel free to email me at Dr. Kat, which is dr.kat@jheaththerapy.com.
Very good. Okay, thank you.
You're welcome.
Thanks for spending time with us today. We loved diving into this important topic with Dr. Heath and hope it gave you a fresh perspective on how pelvic health connects to your overall well-being. Stick around, we've got more great conversations coming your way soon. A big thank you to our featured sponsor, Bleaches NC, your expert carpet and upholstery cleaning service. From stubborn stains to odors, they tackle it all with safe, effective solutions. Don't forget, mention the Nurtured Woman podcast for 15% off your first cleaning. Call 984-51-GRIME today. Another thank you to Kristen Dorninger. Buying a home is a huge decision, and Kristen is the realtor you want by your side. Professional, trustworthy, and genuinely invested in finding the right home for you. Kristen handled all the details and made the process seamless for my family. Want to get your business in front of an engaged audience? Podcast ads boost brand awareness by 28%. That means more people remembering you. The Nurtured Woman podcast is the perfect place to share your message. We'll craft a custom ad and feature it in the middle of the show. Don't miss this chance to connect with our listeners in a meaningful way. Let's get your business heard. Reach out today to Michele Droll at mdroll@lknconnect.com.